Hey everybody, and welcome to another deep dive.
Mm.
We're tackling something today that might hit close to home for a lot of you out there,
Oh, yeah.
especially if you're a parent,
Mm.
or a caregiver,
Mm-hmm.
or, hey, maybe even someone thinking about going into pediatrics someday.
Right.
We're going deep on inguinal hernias in kids.
Okay.
Now, I know that term can sound a little scary,
Yeah.
but don't worry, we're going to break it all down.
Okay.
Make it easy to understand, and we've even got some surprising stuff you probably wouldn't find just doing a basic web search.
Interesting.
We're working from a really cool excerpt of a medical textbook,
Right.
and I am so curious to hear what our expert can pull out of this for us.
Well, what's fascinating about these inguinal hernias in kids is they're actually way more common than folks realize. But
Ugh.
they often kind of fly under the radar early on.
Oh, interesting.
It's like this hidden puzzle right there in plain sight.
I love that, a hidden
Wow.
puzzle.
Yeah.
Okay, so let's start with the basics then.
Sure.
Paint us a clear picture. What an inguinal hernia?
All right, so picture this. You've got a weak spot in your abdominal wall.
Okay.
Kind of like if you had an old tire and it's got that little bulge.
Uh-huh.
That weak spot lets a bit of the intestine,
Oh.
or sometimes it's just some fluid,
Mm-hmm.
to poke through. And in babies, that bulge, it often shows up right there in the groin.
That makes sense. And I bet all the stuff babies do, like all that crying,
Oh, yeah.
the straining,
Absolutely.
makes that bulge even worse.
That just increases the pressure inside their belly,
Right.
which pushes that little bit of intestinal fluid outwards.
Mm.
Now, here's where it gets a little trickier.
Okay.
There are actually two main types:
Okay.
indirect and direct hernias.
Okay.
And indirect, those are way more common in kids.
So indirect versus direct.
Yeah.
What's the difference? I'm trying to picture this in my head.
All right, think of it this way.
All right.
Babies, before you're even born, they develop this little passageway. It's called the processus vaginalis.
Processus vaginalis.
Yeah, big word.
That's a mouthful.
But usually this passageway, it closes up all on its own,
Okay.
but sometimes it doesn't. And that's what creates the path for an indirect hernia to form.
Interesting.
Now, a direct hernia that's different,
Uh,
that happens when the actual abdominal wall itself, it weakens and forms a bulge.
so most kids, it's like this door that was supposed to shut,
Mm-hmm.
but it got stuck open instead.
Exact.
Okay, that's a much better image for me than a whole new hole in the wall.
Right.
Okay, so I know every parent listening right now
Yeah.
is wondering, just how common are we talking here?
Right.
Is this like a 1 in a million thing, or is this more like 1 in 10?
Thankfully, it's not 1 in 10.
Okay.
But it's more common than you might think.
Okay.
So about 1 to 5% of all newborns will have an inguinal hernia.
So for every 100 babies born,
Yeah.
you're saying 1 to 5.
1 to 5 will have this condition.
That's surprisingly common. Makes you think how many babies we see every day
Right.
might actually have this and not even know it.
It really does. And here's where it gets even more interesting.
Okay.
For preemies,
Yeah.
that risk jumps up to 9 to 11%.
9 to 11.
Almost 1 in 10.
Wow.
Premature babies, they're just more vulnerable because their bodies haven't fully developed.
That makes sense.
Yeah.
But man, that's got to be concerning for those families.
Yeah.
Okay, so
Ah.
let's talk about how we even day end them now.
Yeah, okay.
If a baby has this,
Yeah.
what are the signs? What are the symptoms should
Mhm.
parents be looking out for?
Sure.
I'm guessing it's not always as simple as just seeing that bulge.
You'd think so, right?
Yeah.
But here's the thing.
Go ahead.
Sometimes there's no visible bulge at all,
Really?
even when a doctor examines the baby.
Huh. So if there's no bulge, how in the world do they even diagnose it?
That's where a doctor's expertise really comes in.
Okay.
They use something called the silk sign.
Silk sign.
Yeah.
What is that?
It does sound kind of delicate.
Yeah.
But it's a very practical way to check.
Okay.
Picture this: the doctor runs their finger gently along the inguinal canal, right around the pubic bone.
Okay.
If they feel this kind of silky thickening of the cord, it could be a sign of an inguinal hernia.
So it's like a subtle clue,
Yes,
but a trained hand knows what to feel for.
exactly.
Okay, well, let's talk about something that can get a little scary with these.
Okay,
Because sometimes those hernias can get stuck, right?
that's right. And when a hernia gets stuck or incarcerated,
Okay.
it means it can't be pushed back in,
Hmm.
and that's when things can potentially become dangerous.
Dangerous. How quickly can it go from, just kind of there to we've got a problem?
So when it's incarcerated,
Yeah.
it means the blood supply to that trapped piece of intestine could get cut off.
Oh, no.
and that can happen quickly.
Like how quickly?
Sometimes within hours.
Hours.
Yeah.
Wow, that's not a lot of time.
No.
So what happens then is it's straight to surgery.
Not necessarily. There's a procedure called manual reduction that doctors often try first.
Okay, manual reduction.
Right.
I need you to explain that one.
Sure.
It's not like some wrestling move, right?
No. It's actually very gentle, and it usually works really well.
Okay.
It's basically using gentle pressure to try and push the hernia back into place. And it's often done with sedation so the child doesn't feel any discomfort.
So no scalpels involved.
Exactly. It's the first line of defense in most cases.
Okay, good to hear.
And helps avoid surgery the majority of the time.
But I imagine there are times when surgery unavoidable.
Yes, unfortunately, sometimes it is.
Okay.
If that manual reduction doesn't work.
Right.
Or if there are other complications, then surgery becomes the next step.
And in those cases, what happens?
So the surgeon, they go in, they close that open tunnel
Uh-huh.
and remove any extra tissue.
Okay.
It's a very common procedure with a quick recovery.
That's good to hear, but what about the recovery itself?
Well-
I imagine parents worry about pain, how soon their kid can get back to normal stuff.
Of course, those are all valid concerns.
Yeah.
The good news is most kids recover really quickly after this surgery.
Okay.
Pain is usually well managed,
Mm-hmm.
and activity restrictions are minimal.
Okay.
But remember, every child is different,
Right.
and the best source of information will always be your child's doctor.
That makes sense.
They can give you specific guidance based on your child's needs and how they're doing.
So we've talked about how these are more common in boys.
Yes.
But what about girls?
Yeah.
Anything special to consider for them?
That's a great question. Girls have their own version of that processus vaginalis
Oh, okay.
called the diverticulum of Nuck.
Diverticulum of neck. Got it.
Another mouthful.
Yeah.
But here's where it gets a little more complex.
Okay.
In girls, the ovary can actually be involved in the hernia.
Whoa, the ovary.
Yes.
Okay, so we're not just talking intestine here.
That's right. And because of that, doctors often use ultrasound to check what's inside the hernia sac.
Makes sense. Better to be prepared.
Right.
Now, I know we touched on surgery.
Yeah.
But is there a chance these hernias can come back even after they're fixed? I bet that's a big worry for parents.
You're absolutely right. Recurrence is a common concern.
Okay, so it's not impossible.
While it's uncommon, it is possible for a hernia to return even after surgery.
Okay, not what I wanted to hear, but I appreciate the honesty.
Of course.
What's the recurrence rate then?
Yeah, so the overall rate is about 6%.
6%. Okay, so thankfully pretty low.
Thankfully quite low,
Yeah.
but certain things like prematurity,
Uh-huh.
connective tissue issues,
Right.
history of incarceration,
Mm-hmm.
those can increase the risk a little.
So not impossible, but not super likely either.
Exactly.
This has been so informative already. We've covered so much
Yeah.
from what this, even IS to those potential complications and treatments.
Absolutely, and we're just getting started.
Right in the next part of our deep dive, we'll be exploring some of those cutting-edge, minimally invasive techniques and looking at how treatment for this might even evolve in the future.
Exciting.
So stay tuned.
All right. Medical science is always moving forward, right?
It really is.
It's amazing.
Yeah.
And even something like inguinal hernia repair, which
Yeah.
seems pretty straightforward,
Right.
is constantly being refined and improved.
That's what I love about these deep dives. We get to really get into the details,
Yes.
the latest stuff.
Absolutely.
So speaking of advancements,
Okay.
you mentioned minimally invasive techniques.
Yes.
What are we talking, like tiny robots doing surgery inside a baby's belly button?
Not quite robots in the belly button.
Okay.
But you're on the right track.
Right.
Laparoscopic surgery has really changed things
Agreed.
in so many areas of medicine. And pediatric inguinal hernia repair is no exception.
So instead of making a big incision,
Yeah.
you're using,
Right? So instead of a big incision, surgeons use a tiny camera
oh, wow.
and special instruments
Okay.
that are inserted through these very small incisions.
So it's like those laparoscopic surgeries you see on TV,
Exactly.
where they're using those long, thin tools to work inside the body.
That's exactly it.
Okay, cool.
And the benefits are pretty great.
Yeah.
Laparoscopic repair usually means less pain,
Okay.
faster recovery,
Mm-hmm.
smaller scars.
So for parents, that means
Yeah.
their kid is back to normal sooner.
Yes. And with less discomfort.
That sounds like a win-win.
Absolutely.
Less pain, faster recovery,
Yeah.
smaller scars.
Yeah.
Who wouldn't want that?
Right.
But I'm guessing there's some downsides too.
Right. You're always thinking critically.
I like that.
Got to keep you on your toes.
Right.
Nothing's ever perfect,
Of course.
especially in medicine.
And like any procedure, laparoscopic repair does have its limitations.
Okay. So
It requires specific training, specialized equipment.
and it might not be suitable for every single type of hernia.
So it's not a one-size-fits-all solution.
Right.
Parents still need to talk to their child's surgeon,
Yes, absolutely.
figure out the best approach.
Personalized medicine is key here.
Right.
What's right for one child might not be right for another.
Makes sense. But speaking of personalized medicine,
Okay.
what does the future hold for inguinal hernia repair?
So the future is looking even more tailored and precise.
Okay, now you've got me really curious.
Yeah.
What's on the horizon? Are we talking gene editing, stem cell therapy,
Uh-huh.
something straight out of science fiction?
Well, while those advancements are exciting,
Okay.
the immediate future likely holds even more refined laparoscopic techniques, maybe even robotic-assisted surgery.
Okay, robotic surgery.
Yeah.
That does sound like sci-fi.
It might sound futuristic,
Yeah.
but it's actually becoming more common in many types of surgeries.
Interesting.
Robotic systems give surgeons this incredible precision, dexterity, and visualization,
So better outcomes for the patient.
which can lead to even better outcomes for patients, yes.
So it's like having a tiny, incredibly skilled surgeon with super steady hands operating inside the body.
It's really remarkable.
That's incredible.
And beyond those surgical techniques,
Yeah.
research is ongoing
Oh, cool.
to find ways to prevent hernias altogether,
Okay.
maybe by identifying certain genetic markers
Right.
or developing brand new materials to strengthen those weak spots in the abdominal wall.
Now that would be a game changer.
Yeah.
Imagine if babies didn't even have to worry about these.
It's a goal worth striving for.
Yeah, for sure.
And while we're not quite there yet,
Okay.
the progress being made in pediatric surgery is truly inspiring.
I'm feeling really optimistic about the future.
Good.
But before we get too carried away with all this futuristic stuff,
Yeah.
let's bring it back to the present
Okay.
for parents listening right now.
Yeah.
What are the key takeaways they should remember about this?
Sure.
What are the absolute must-know-s?
Great question. Let's break it down into a few essential points.
Okay, love it.
First and foremost, inguinal hernias are common in children, especially babies under a year old,
Okay.
and even more so in premature babies.
So if you're a parent listening, don't panic if you hear this diagnosis, but definitely take it seriously.
Exactly. Early detection is crucial.
Yeah.
Know the signs, know the symptoms, which can be subtle.
Right.
Don't hesitate to talk to your doctor if you notice anything unusual,
Yeah.
even if you're not sure it's a hernia.
Better safe than sorry, right?
Absolutely. Second, if a hernia is diagnosed,
Yeah.
remember that treatment is usually pretty straightforward and effective.
Okay, that's good to hear.
Manual reduction often works.
Yeah.
And if surgery is needed,
Yeah.
it's typically a quick recovery.
And we've got those minimally invasive techniques becoming more available, too.
Exactly, which can make the whole experience less stressful for everyone.
Sure. And finally,
Yes.
don't be afraid to ask questions.
Please ask questions.
Your child's doctor
Yeah.
is your best resource
They are the best resource.
for personalized advice and guidance.
Exactly.
So be informed,
Yes.
be proactive,
Uh-huh.
and be your child's advocate.
Advocate for your child, yes.
Great advice.
Thank you.
Now, I know we've been focusing a lot on the medical stuff here,
Mm-hmm.
but what about the emotional impact on families?
Okay.
Having a child go through surgery, even a relatively minor one,
Right.
can be really stressful for parents.
It can,
Yeah.
and caregivers.
You're absolutely right.
Yeah.
The emotional toll on families is something we take very serious.
I'm glad to hear that.
And that's what hospitals,
Yeah.
surgical teams, they're increasingly incorporating this psychosocial support into their care plans.
So it's not just about treating the physical condition.
Right.
It's about supporting that whole family unit.
The whole family, yes. Through this experience.
Exactly.
That's so important.
It is. And that support can take many forms.
Okay.
From child life specialists who help kids understand and cope with medical procedures
Yeah.
to social workers who provide resources and guidance for families.
Like a good reminder that healthcare, it's about so much more than just the technical stuff.
It really is.
It's about compassion, empathy,
Yeah,
understanding that human impact.
absolutely.
This deep dive has been such a journey. We've covered so much.
Yeah.
From the basic anatomy of this to the cutting edge of surgical techniques.
Right.
To that emotional impact on families.
I feel like I could have a conversation with a pediatric surgeon now.
I know, me too, and actually know what they're talking about.
That's fantastic.
But I have one final question for you.
Okay.
If you could leave our listeners with one lasting thought, one piece of wisdom to guide them as parents, as caregivers, or simply curious minds,
Sure.
what would it be?
That's a great question. If I had to distill it down to one essential message, it would be this. Never underestimate the power of knowledge, curiosity, and a willingness to ask questions.
I love that.
The more you know, the better equipped you are to advocate for yourself, your loved ones, and your community.
Beautifully said. It's a reminder that learning, it's a lifelong journey.
It is.
And even the most complex topics can be broken down and understood with a little effort and guidance.
It's true.
Well, on that note of empowered learning,
Okay.
we've reached the end of our deep dive into inguinal hernias in children.
It's been a good one.
Huge thank you to our expert for sharing their knowledge and insights.
It's been my pleasure.
And to our listeners,
Yes.
thank you for joining us on the deep dive.
We appreciate you.
We hope you've learned something new, gained a fresh perspective,
Right.
and perhaps even been inspired to explore further on your own.
Absolutely.
Remember, this was a deep dive, not medical advice.
Right.
Always consult with your child's doctor
Yes.
for any specific concerns.
Please do.
Until next time, stay curious.
All right.
You know, we've talked about all the different ways to actually treat these hernias.
Right.
But something that really struck me is how much pediatric medicine focuses on making this as easy as possible for the kids.
Yeah, that's a really key point.
Yeah.
Children are not just little adults.
Right.
They have unique needs,
For sure.
especially when it comes to something like surgery.
Exactly. It's not just about fixing the problem. It's about fixing it the right way.
Right, in a way that minimizes the stress, helps them heal, thrive.
So it's not just about the medical side,
Right.
but the child's emotional well-being too.
Exactly. And that approach is evident in everything, from the way they manage pain to the actual surgical tools they use, designed just for kids.
That's pretty amazing.
It is.
A lot of thought goes into this.
A lot of care goes into it.
Speaking of care, I know we've been deep in the medical weeds, but what about that emotional impact on the families?
Right.
Having a child go through surgery,
Yeah.
even a relatively minor one,
Yeah.
it can be so stressful.
It can be really stressful for parents and caregivers.
Oh, absolutely.
You're right.
Yeah.
And the emotional toll on families is something that we take very seriously.
I'm really glad to hear that.
That's why hospitals and surgical teams, they're building in more and more of this psychosocial support into their care plans.
So it's not just about treating that physical condition.
Right.
It's about supporting the whole family.
The whole family unit through this time.
Through this experience.
Yes, exactly.
That's so important.
It is, and that support can take so many forms.
Yeah. Like
They've got child life specialists
All
who
right.
can help kids understand, cope with these procedures.
Yeah, make it less scary.
Exactly. Then you've got social workers who can give families resources and guidance.
It's a good reminder that healthcare, it's about so much more
It is.
than just the technical stuff.
Absolutely.
It's about that compassion,
Yeah.
empathy,
Uh-huh.
understanding that human impact.
It really is.
This deep dive has been quite a journey.
It has.
We've covered so much ground,
We have.
from the basics of inguinal hernias
Right.
to the latest surgical techniques to the emotional side of things for the families.
I feel like I could have a conversation with a pediatric surgeon.
Well, I know, me too, and actually know what they're talking about.
That's great.
But before we wrap up,
Okay.
I'd love to hear your final thoughts. If you could leave our listeners with just one piece of advice, one thing to guide them
Yeah.
as parents, as caregivers, or just curious people, what would it be?
If I had to boil it down to one key message,
Okay.
it would be this. Never stop learning. Stay curious.
Yeah.
And don't be afraid to ask questions.
I love that.
The more you know, the better equipped you are to advocate for yourself, your loved ones, your community.
Beautifully said. It's a reminder that learning, it's a lifelong journey.
It really is.
And even the most complex topics can be broken down and understood
They can.
with a little effort and the right guidance.
It's true.
Well, on that note of empowered learning,
Okay.
we've reached the end of our deep dive into inguinal hernias in children.
It's been a good one.
Huge thanks to our expert for sharing your expertise with us.
My pleasure. I always enjoy these conversations.
And to our listeners, thank you for joining us on the deep dive.
Yes, thank you.
We hope you've learned something new, maybe gained a fresh perspective,
Right.
and perhaps even feel inspired to keep exploring this topic.
Absolutely.
Remember, this is a deep dive, not medical advice.
Right.
Always consult with your child's doctor.
Yes, please do.
For any specific concerns.
Absolutely.
Until next time, stay curious.